About one-third of strokes will result in some type of aphasia. One type of aphasia is Broca's aphasia. Broca's aphasia is a neurological disorder that affects one's speech and language abilities, typically after a stroke. Usually, this type of stroke occurs near an area of the brain called Broca's area, which is the part of the brain that makes the motor plan for speech production, like a conductor of a train. Broca's area is located in the frontal lobe of the brain.
Patients affected by Broca's aphasia usually understand simple sentences and know what they want to say, but experience difficulties producing the words due to damage occurring in the area of the brain that controls the motor production of speech.
Speech will become non-fluent and choppy for a patient with Broca's aphasia. These patients will communicate with only short phrases consisting of a few words and long pauses. Patients will struggle to produce grammatical sentences that make sense to the listener.
One expressive language issue a patient with Broca's aphasia will experience is agrammatism, which is speech containing content words but no function. For example, if an SLP asks a patient to describe their dog, he or she may respond saying big, yellow, tail. Watch this video to see an example of the effects of Broca's aphasia.
So what's your name?
Scott. Oh, no. Sarah Scott.
That's right. And how old are you?
I can't.
Try.
I can't.
You're 19. 19.
Yeah.
Yeah. And what happened to you?
Stroke. School and English class,
Okay.
and I book and I read it aloud, but I can't because stroke.
And what happened after the stroke with your speech?
But I can't.
What do you do now? Every day?
Oh, speech, then the speech,
Therapy?
yeah,
Okay.
and also riding.
Riding what?
Oh, horses.
Yeah, good. And how do you feel?
I'm fine.
You're fine. That's good.
In certain situations, the articulation cranial nerves may be affected. These cranial nerves consist of the facial, hypoglossal, vagus, glossopharyngeal, and the spinal accessory nerves. Cranial nerves are not directly affected by Broca's aphasia, but they may be damaged from the stroke itself. Broca's aphasia is a motor planning issue, and this strictly takes place in Broca's area.
A patient who has Broca's aphasia will experience difficulties in everyday life known as barriers. The three barriers of disabilities are function, activity, and participation. Function barriers include problems with body or brain function. The brain does not function as it should due to the lesion in Broca's area. For example, language will be hard for a patient to produce. The activity barriers associated with Broca's aphasia will lead to difficulties in performing activities of daily living, such as communicating needs and pain. Participation barriers are problems with involvement in any area of life, such as education, employment, and social outings. A person with Broca's aphasia may not be hired for a job that involves heavy communication, such as a restaurant or a call center.
There is no cure for aphasia, but a person's communicative abilities may improve by speech therapy over time. Intervention strategies for a person with Broca's aphasia can include, but are not limited to, eliminating background noise, speaking slowly and at a normal volume, using gestures when speaking, and allowing enough time for the patient to speak. Speech-language pathologists can incorporate melodic intonation therapy, which teaches the client to speak with a sing-song voice. This type of therapy will allow the speaker to have more control over their fluency of speech. Having conversations with a person affected by Broca's aphasia is key to their recovery.